Hey there, lacrosse lovers, and welcome to the fast and fierce world of women's lacrosse, a game full of heart, hustle, and some seriously epic plays. We're all about the thrill of the game, but sometimes those quick cuts and sudden stops that we love to see can put a little bit too much pressure on our knees. Yep, we're going to talk about the infamous ACL injuries. But don't worry, this story has a happy ending. In this video series, we'll dive into all the ways you can bounce back stronger with fun, effective lower ligament exercises. Think of it as a rehab journey with a side of empowerment and a sneak peek from your very famous, very fabulous University of Pittsburgh women's lacrosse team. So stick around because whether you're recovering, staying strong, or just curious about what's going on, we have you covered. So let's keep those knees happy, healthy, and ready to dominate the field. A novel technique that can be used during rehabilitation is blood flow restriction. With blood flow restriction, a cuff is placed around the patient's leg, creating a oxygen restricted environment. This oxygen restricted environment forces those muscles into a anaerobic state, i.e. tricking your muscles into thinking that they're working harder. This allows the patient to use less weight on the injured limb or any appendage while still getting maximum results. This is an amazing technique, and in this video, we're seeing it applied to hip abduction. Essentially, we're moving the hip away from the body's center, and the workout is targeting key muscles such as the gluteus medius, gluteus minimus, and tensor fascia lata. In this video, we are witnessing a knee extension. Knee extensions involve movement at the knee joint, anatomically referred to as the tibiofemoral joint, a hinge between the femur and the tibia. During knee extensions, the angle between the femur and the tibia increases, transitioning the joint from a flexed or bent position to an extended straight position. This motion occurs in the sagittal plane. The main muscles associated with the ability to perform a knee extension include the quadricep. These four muscles, rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius, work together to provide the strength and stability that you've grown accustomed to, primarily from your quadricep. Think of them as a well coordinated team ensuring your lower body stays strong and functional. We're witnessing one of the most crucial exercises in rehabilitative medicine, a hamstring curl. The patient is positioned facing the therapy table, targeting crucial posterior thigh muscles. Our patient is activating the bicep femoris, both long and short heads, semitendinosus, and semimembranosus. These muscles are essential from everything from walking to explosive movements like jumping. This is one of the most critical exercises that patients will encounter with rehabilitation.
Demonstrated in the prone position, this hip extension exercise involves posterior movement of the leg from the hip joint, typically spanning 10 to 15 degrees of motion. The gluteus maximus, which is the body's largest muscle, serves as the primary mover. Additional muscles engaged include adductor magnus, semimembranosus, semitendinosus, and bicep femoris. Check out this side-lying hip adduction exercise. Our subject is carefully positioned to move the leg towards the body's midline while maintaining perfect alignment. It's all about precision and control. The muscles at work you can see includes adductor magnus, adductor longus, adductor brevis, and gracilis, a group of muscles that play a crucial role in leg movement and stability.
This exercise is the calf raise. The calf raise works muscles in the posterior lower leg compartment. The muscles focused here are the gastrocnemius and the soleus, which is the primary plantar flexors. The gastrocnemius splits into two heads, which attach to the knee and the heel, as well as the soleus, which attaches to tibia and fibula. The final exercise demonstrated here is the straight leg raise. A quick pro tip is it stabilizes the anterior superior iliac spine. Interesting, if you can't raise your leg beyond 80 degrees, it can indicate tight hamstrings, which are not engaged here. The muscles that we are engaging are the rectus femoris, quadriceps femoris, vastus lateralis, vastus medialis, and vastus intermedius, which are all in the anterior compartment of the thigh.